Hi, I'm Suzanne Ottinger, and in September of 2021, I was having my regular colonoscopy, and I had been having some dysphagia, some throwing up when I would eat. I'd had a lot of pain when I would eat, and that had been going on off and on for a couple years. And the doctors always just thought it was some sort of reflux. So it was time for my colonoscopy. We went ahead and added the endoscopy because of those symptoms, and they did find a large tumor at the top of my stomach. So from there, within a few days, I was sent for scans, and it had already, right at diagnosis, metastasized to my bones. So I was diagnosed with stage 4 gastric cancer, September of 2021. And they did do biopsies on my tumor. And at that time, they looked for HER2 and PD-L1. I was HER2 negative and PD-L positive with a score of 10. My treatment started immediately after my diagnosis. October of 2021, I had 6 months of Folfox and Opdivo and Extiva. I had a great response, but the oxaliplatin becomes too toxic for everybody, so that gets dropped. So for then a year, I had 5-FU, Opdivo, and Extiva. And I did so well that we took a break from the chemo, and I took a little bit too long of a break, and I did have a recurrence in my bones. So I went back on the chemo. I did the Capecitabine instead of the 5-FU. They're really the same thing. One's in an infusion and one is in a pill form. So right now, I'm on the Capecitabine with the Opdivo and the Extiva for my bones, and I'm having response again. It's working. My symptoms are gone, really. I feel great. And my bone marker has gone down almost to a normal level. And then I did have a couple spots of radiation done, and that has helped as well. So I'm doing, it's been a long journey, but technically I am still on first-line therapy after 26 months. So I'm very, very blessed. There's no way that you're going to be cured from chemotherapy. It's very unlikely. So you really have to have the biomarkers and the immunotherapy to have a long, durable response. If you don't know your biomarkers, you can't choose a treatment. And if you can't choose a treatment, what are you going to do? You have to have your biomarkers, or else there's no treatment options for you other than chemotherapy. I really hope that when patients are first diagnosed, that they try to get as much information as they possibly can. You can right away send out for the NCCN guidelines and find out all the biomarkers that are being tested for your type of cancer, and make sure that you're getting that information. The more information you have right from the beginning, the more treatment options you will have down the road.